Hey, Margie here. Did you know that the single best predictor of whether a senior citizen will fall is their toe strength? This is not something that's typically tested or even worked on. We do lots of foot and ankle exercises, but not specifically toe strength. So I'm so excited to discuss this topic with our very special guest, Dr. Tom Michaud. And Dr. Michaud, for over 40 years, has been in clinical practice, and he's designed and patented numerous diagnostic tools, as well as exercise products to help with the evaluation and treatment of a wide range of sports injuries. That's how it started. But then what he's done since his retirement from clinical practice, and he just goes by Tom, he's devoted his time to researching, writing, and designing new products that are evidence-based and treatment protocols that can not only help for people recovering from sports injuries, but help us stay fit as we age, improve our balance, and prevent falls. So this talk is full of so much amazing information. One of his products is something I use all the time, and it's made a huge difference in my toe strength because I didn't even realize it was weak. So anyway, this is full of great information, and you absolutely must listen to this because there's great takeaways that can improve your balance, prevent falls, and help with so many other things as well. So stay tuned. Welcome, Tom. You have no idea how excited I am to have you on the podcast. This is a topic that's very near and dear to my heart, and I'll explain, but also something that my community and the osteoporosis community does not know about, but yet it's really important. So welcome.
Hey, thanks for having me. That was nice of you.
I just have to share why I am so excited about having you on this podcast. So I'm doing this Onero strength training program. And it's the first time I went to meet with Dr. Claudia Tomas, she did an evaluation. And she said, Margie, your toe strength, your big toe strength is so weak. And I've had issues. I have something called hallux rigidus. I've had issues with my big toe for years. Not a big deal. But the truth was, it was weak. And she said, it's not just you, that she has learned because of your work how important it is for toe strength. So really anyone with osteoporosis, anyone as they get older, really anybody at any age needs to deal with their toe strength. And it's not something we test, or we rarely even do that. So anyway, then she had me work on this amazing device called ToePro, which you created. And now my toes are so much stronger. My foot just feels so much better. So I am very grateful. All the women, we all bought these. All the women in the program. I mean, there's a whole bunch have this thanks to you. So that's why I'm so excited to have you. But I want to share with everybody listening because this is not something you've heard. And there's things you can do about it that's really going to make a difference for really preventing falls. I mean, and really, and that's what we're trying to avoid here. So welcome.
Hey, thanks again. Thanks for having me. It's funny, I made that ToePro a bunch of years ago in an attempt to decrease fall rates in old people over 60. Because Karen Michaud is a podiatrist down in Australia, and she did some great research. She went into a senior center where the average age was a little over 70. She measured all these different parameters, ankle range of motion, like body weight, different things. The single best predictor of someone having a fall over the length of that study was if they had weak toes. And the former editor of Foot Ankle International, Hilton Menz, had a simple test that you can, and just to quickly explain why weak toes predicts falls, everybody who's listening now can do an easy test. You just stand up because most falls happen at the initiation of gait, not while you're walking. And when you are first initiate gait, you don't realize it, but it's a complicated process. In order to, from a standing still position, in order to initiate gait, your central nervous system has to relax large calf muscles, especially gastrocnemius. That begins a forward fall that is controlled by you pushing down with your toes. And you can do it at home. Just stand up right now, put your arms at your side, then lean forward, keeping your spine and hips straight. The first thing you feel is the tips of your toes pushing down. If the tips of your toes are even slightly weak, you're more likely to have a rapid forward acceleration, which greatly increases the risk of a fall. So Hilton Menz, who used to be the editor of Foot Ankle International, had a simple little test for measuring toe strength, which you can also do at home. It's called the paper grip test. It's been around forever. You take a standard business card, put it under the second, third, and fourth toes while someone's seated, tell them to push down with their toes, and then you pull it out. If it pulls out easily, they have weak toes. So I saw Hilton's test. I know Hilton. So I duplicated the coefficient of friction on the cards, and then I attached it to a dynamometer that measures strength. So now you can quantify it. And they've shown that if you have less than 10% of your body weight generated beneath your big toe, you're more likely to fall, and less than 7% beneath your little toes, although not enough research has been done with that. But they've shown that as we age, you lose toe and foot strength at a quicker rate than other muscles. You can lose 1 to 2% body mass every year starting at the age of 50. So it was just a nice way to quantify it. And then the reason that I made that ToePro, a researcher named Goldman looked at different ways to strengthen toes, pick up the marbles, put a towel curl. None of them worked that effectively. So what he did is he made a little dynamometer where they cocked the toes back 40 degrees and then did isometrics. And he showed that when the toe muscles were exercised in a lengthened position, they got 4 times the strength gains, which correlated into longer stride lengths, increased vertical height, increased horizontal jump distance, which is why everybody in the NFL is using that thing, because it increases horizontal jump distance. I mean, I made it to prevent falls in the elderly, and for the first 3 or 4 years, it was only used by NBA and NFL players and long-distance runners. So you weaken in your toes faster. So that platform has a series of elevations that stretch specific muscles to duplicate the Goldman study, correct? So that first platform works your long digital flexors, and then it's tilted down sideways like this. There's muscles on the outside of your leg called the peroneals, and if they're weak, you can fall sideways. So it works the peroneals in a lengthened position by going from inversion or tilted in, eversion. So it's simple. In compliance, before I used that, I used to use a program that Karen Michaud came up, TheraBands, the 5 sets of 20. It took 45 minutes to do, and compliance was like 0. I made that thing, and compliance skyrocketed. And they studied it at Temple University, and they got 30% increases in foot strength in just 6 weeks. It also improved balance, and it increased the amount of force generated beneath the medial forefoot during the gait cycle, which is important. It improved balance.
We all know that foot and ankles, like their foot is one of your big predictors of falls, but not such detail about toe strength. And like you said, those are typical exercises, with the towel and the marbles and I thought you had some great articles. I know that you said are on your website, but in one of your articles, you explained that when they found the improvements, it was the toe strength. It wasn't that their quads or their hamstrings, it wasn't that their leg strength was what was preventing, it was showing the improvement in reduction in falls. It was the toe strength. So
Quad strength is important with preventing falls going downstairs. So, and a paper just came out, which I loved. They measured them with MRIs, the volume of all the muscles in the lower extremity as people age. So they looked at people in their mid-20s and people in their 70s and 80s. And rectus femoris, one of the central quad muscles, thinned out faster than almost any muscle. So quad strength is important. That's why I made that fall prevention program. I don't know if you had a chance to see it. It's a series of 12 quick tests that have proven validity. And they're simple to do. Like one is sit in a chair and time. How fast can you do 5 get out of the chairs? And if you have difficulty, if you can't do it in a certain time length, then you've got to exercise your quad. So I made a program to say, how do you identify which muscles are weak? Like your hip rotators have to generate 20% of your body weight. Your ankle has to move up a specific range. Your toes have to generate 10% of your body weight. And if you fail any of them, then you perform those interventions. So you don't have to do a whole protocol. It just targets your weak points.
Is that one on your website as well?
That's the best. That's my favorite. There's over 100 references in that paper. It's the Human Locomotion Fall Prevention Program. Made a course that doctors take in it. It's a 90-minute course, and we're figuring out a way to get people credentialed in it so that people can see these people to get the tests done. Most of the tests you can do yourself at home, but a lot of them require like some testing equipment. But it's got really simple interventions on how to prevent falls, everything from calf stretches hip rotator strengthening devices. And here's one really simple test that I just found fascinating. As you age, the bottom of your foot has 4 different types of cutaneous receptors that measure pressure. As you age, they lose their ability to determine pressure by as much as 80%. And if you've ever had spinal stenosis, if you've ever had sciatica, even if you've had an ankle sprain, the skin in certain areas becomes less sensitive. And a researcher recently used a technique called microneurography, where they measured the location of every single cutaneous receptor in the skin on the bottom of the foot, and almost all of them are beneath the outside of the foot. Because if you start to shift your weight too far laterally, they signal you that you're going to the side to make sure you come back. But as you age, those the nerves don't function as well. And you can take a 256 cycle per second tuning fork, which you can get on Amazon. They use it in music. They'll tune instruments with it. You just hit it on the ground. You tap the bottom of someone's heel and hold it there. If they can't feel it, the vibration at 256 cycles per second, then they have impaired sensation. So I use that. And they also have impaired balance almost always with that. So if they have that, I just patented this other product called the balance buttons, because lateral falls cause you to strike on your hip, and our hips are designed to not be able to tolerate lateral falls well because our femoral neck is angled like this. I made this little thing, and there's these little buttons on it, right? You put it on the outside of an insole, so it's kind of hanging off. So if your foot starts to shift too far laterally, at first you feel these little ones, but if you don't have sensation, you don't really feel them that well. But these large elevations, if you go too far to the side, even if you have impaired sensation, you can feel it. And a couple of different facilities have started studying them now with people with peripheral neuropathy, and which is a high risk for falls because they can't feel the skin on the bottom of their feet. And it protects against lateral falls. When you put them on what's called a force plate that measures the location of your center of mass, it tells you if you're going too far to the side. And if you do go too far to the side, you feel those lumps, even with nerve injuries, and then you come back to the center. So it's simple. They're inexpensive. You just throw it on the inside of your insole. It couldn't be easier. It's one of my favorite products. We just came out with it a little while ago, and the patent just came through on it. But I just really like that product because it's inexpensive and it's easy.
Yeah, I mean, you've just made all these amazing products. This is so fantastic.
Thanks.
I just want to say one more thing, because let's just go over. You said something, but I really want people to get this. That strengthening your toe in a lengthened position is way more effective than strengthening it. So you just want to explain that a little more detail, what that meant?
Oh, sure. Not a problem. When you look at any given muscle, say you're doing bicep, if you strengthen your bicep in this range where it's in a midline position, it won't get as strong as if you lengthen it here. Someone just published a paper where they looked at strength gains when you did tricep exercises doing push-outs like this versus when it's behind you and you're going like this, which stretches the muscle. They got marked improvement when the muscle was lengthened. It turns out, in order to strengthen a muscle, muscles are made of filaments called actin and myosin. On top of those filaments, and if you've ever cut into a steak, you've seen those little filaments. On top of those filaments are what are called satellite cells. Satellite cells are the powerhouse that regulate the repair and building of new muscle fibers. So if you exercise a muscle in a midline position, all the fibers are here and the satellite cells aren't stretched. If you exercise in this position when the muscle's fully stretched, the satellite cells say, we're going to get hurt in this position. We really need to double down and increase the production of muscle fibers. They increase the extracellular matrix. They make the connective tissue around the muscle stronger. So it turns out neurologically, whether it's your hamstring, your bicep, your tricep, or your toes, if you put a muscle in a lengthened position and fire it, it's going to get stronger. If you only exercise a muscle in a really shortened position, it doesn't increase in volume at all. It can sometimes get stronger, but it doesn't increase in volume. In order to stimulate hypertrophy or remodeling, you get the best results when muscles are lengthened. Which with osteoporosis, I know that most of your specialty is osteoporosis. Osteoporosis is important because a lot of people just think about impact forces with osteoporosis and they say, well, I can do other things. But muscle force generates significant stress on bone that is important with remodeling. So it's an underappreciated component of bony stress. And there's historically, There are multiple examples, like your fibula, the bone on the outside of your leg. When you're doing jumping and aggressive exercises, you're more likely to crack in the middle, which is the interface between your peroneus longus tendon, your peroneus brevis muscle. So the two muscles pull in different directions with enough force to actually crack the bone. So it just shows you that bone remodeling happens in response to muscular pressure, not just impact forces.
Oh, I love that. So the truth is, you have a whole entire I mean, some people are listening to this and they're thinking, oh gosh, because a lot of people, they wear sneakers, cushy sneakers. A lot of people are shuffling. They're really not at all exercising the different muscles, and especially not the toes. So
cushy sneakers is actually a problem. Starting in the late 80s, they showed that if a shoe is too well cushioned, you impair information from the cutaneous receptors. So you don't want to have too well cushioned a shoe. That's why the whole point of this is to have mild irritation at just the right time. Like if you have really good sensation, these things don't work for you because your cutaneous receptors are doing all the right stuff. But if they're not working perfectly, especially in people with peripheral neuropathy, which is increasing, the prevalence of it is constantly increasing, and with the diabetic population and with the chemotherapy-induced peripheral neuropathy population, and you really need to do things to help these people improve their balance. Which another paper just came out on peripheral neuropathy with diabetics, showing that not just cutaneous receptors, but Karen Merkel, the podiatrist down in Australia, she wrote something like 10 years ago, and I was surprised it didn't get more traction. She showed that when you have peripheral neuropathy, if you do foot strengthening exercises, it improves the peripheral neuropathy. And a paper just came out supporting that. It hasn't been studied enough. Peripheral neuropathy patients are not treated well because gabapentin and the different medications aren't that effective for it. But the researchers don't really know what to do because they don't even know what component of the nerve is affected by peripheral neuropathy. So they've shown that nerves parallel blood vessels, and if you do strengthening exercises, you increase nutrient flow to the nerves. So you can help peripheral neuropathy just by doing strengthening exercises. I love it. It's an underserved population, and getting this kind of information out there is really helpful.
It's so debilitating, peripheral neuropathy, and there are some approaches that do help, and there are some alpha lipoic acid. But how wonderful that exercise can make such a difference. So, in terms of the time, people are listening. So, we have this ToePro. How long do you need to spend? Let's just do the nuts and bolts of this. And this is on the website, right? The video is on your website.
Yeah, the video is on the website, how to use it. I used a protocol that used light resistance so that people who weren't fit wouldn't get frustrated with it. And they showed that if you did 4 sets of 25 repetitions at light resistance, you got the same strength gains as if you did 3 sets of 15 fully maxing out. There's controversy in the literature as to the frequency. Should you do it once a week, twice a week, 3 times a week? I recommended 3 to 5 times a week, more because I wanted to stimulate circulation and increase vascular growth. But a paper just came out a few weeks ago showing that once a week of doing strength training is enough to appreciably increase force output. And this is important. People talk about fall prevention and they talk about muscle mass. It's called sarcopenia, sarco for flesh, penia for wasting away. They say that muscle volume is a big predictor of falls, but something called dynapenia is a bigger predictor of falls, and that's weakness. Some people have adequate muscle volume, but they're still weak. So weakness can be addressed with 1 set of 30 repetitions. Compliance with exercise, it's the reason I made this. Compliance with exercise in people who've never been big exercisers is close to 0 at 3 months. And I saw that for a long time. It's part of the reason I made this. So if you did like 3 sets of 15 once a week, you would get stronger. I recommend transitioning from like 2 to 3 times a week to 1 to 2 times per week and varying sets and reps. And I'm going to write a paper on it pretty soon, probably next week or so, with all the new information on sets and reps out there. But I originally said do it 4 times a week. Now, if you really don't like exercising, once a week is good enough to prevent dynapenia. It won't change sarcopenia. Building muscle mass isn't easy. In fact, a paper just came out about a month ago showing that as we age, we have fewer of those satellite cells and they're not as active. So they're hard to get them to kick into gear, just like building bone. You can build bone when you're a teenager without a problem. Good luck doing it when you're in your 60s and 70s. It's just harder. The osteoblasts take more force to get them to kick in and remodel. The satellite cells in your muscles take a little more force, but you can build strength without changing muscle volume pretty easily, actually. That study where they did it at Temple University, it was 6 weeks long.
Well, let's see. I've been doing the Onero since April, the very beginning of April, twice a week. And I mean, there's such a difference in my toe strength. It's so exciting. And even in my arch, just the muscles, because when you do this, there's a whole protocol where you're exercising not just your toe, you're exercising. I mean, I just think it's incredible. And you can do it at home in front of the TV. It's easy as can be. It's quite...
A friend leaves it in her kitchen, and whenever she's doing dishes, she'll just do her ToePro exercise. A friend who's a PT also said she leaves it by her dresser drawer, and that's what she likes about it. You can just do it anytime. And since it's like one, you do the exercise and that's it, you don't have to couple other exercises with it. And again, you lose foot and ankle strength way faster than you lose quad and hip strength. It's the reason runners slow down. And you talked about toe strength increasing, your balance improves, and your step length increases as you do it. So people usually notice it. That's why I get the nicest emails from people, which is always nice.
It's just, I love easy fixes. Not that, some things aren't so easy. Truthfully, like an intense strength training program that really does increase bone density is not the easiest thing to do. But this actually is quite simple to add to a program. And with the other thing, though, I think a lot of people have issues with pronated feet, and they've lost the muscles in their arch. They've lost their natural arch. But that improves with this also because you're exercising all the different muscles.
Some great research shows, how they say flat-footed people are prone to injury. Other studies showed that they aren't prone to injury. And someone recently proved that flat-footed people are only injury-prone if they're weak. If you're a flat-footed person and you're strong in your intrinsics, you have the same potential for injury as someone with a neutral arch. So I feel that flat-footed people roll in so far that they're more dependent upon their intrinsic muscles for stability. Neutral and high arch people have ligamentous restraining mechanisms, so they don't need as much muscle force. They've shown there's increased activity in flat-footed people in that big abductor hallucis muscle on the inside of the arch. And I can look at a flat-footed person's foot. If they don't have a well-developed abductor hallucis, that's the big arch muscle there, they're going to be prone to injury, especially injuries like plantar fasciitis. It also affects balance, unfortunately.
There was something, I read all your articles because they were so fascinating, but there was something so interesting because a lot of people have heel spurs and pain in their heel. You want to share what you've discovered about that? Because that was...
I didn't discover that. A guy named Sullivan did a study, and he took 200 people with plantar fasciitis or plantar heel pain, and he compared them to 70 controls. And they looked at arch height, they looked at body weight, they looked at occupation, they looked at every conceivable variable. And they showed, consistent with prior research, that a tight calf predicted it because your heel leaves the ground prematurely and you load your plantar fascia. But the number one and number two predictors of it were weakness of the pronaus longus muscle on the side of the leg and weakness of the toe muscle, specifically flexor digitorum brevis, the muscles that go to the second to fifth toe. And you don't realize it, but plantar fascia is like this on the bottom of your arch. Flexor digitorum brevis is on top of it. Flexor digitorum brevis fires to offload the plantar fascia. The plantar fascia is just very stiff connective tissue with a limited ability to elongate. And if it doesn't get protection from flexor digitorum brevis firing, then it gets elongated, it gets microscopic tears. It can even pull on the heel bone, the calcaneus, and cause stress reactions and stress fractures. So Sullivan was the first one to point out, to my knowledge, that flexor digitorum brevis was a huge predictor of the development of plantar fasciitis. And that research has been proven over and over again that there's little correlation with arch height, which is interesting. But they demonstrated, a guy named Waring showed it in the late 80s using three-dimensional imaging, that people with plantar fasciitis, their toes move up faster during the propulsive period. He didn't put together that might mean their toe muscles were weak. He just said it correlates with it. But yeah, toe weakness is a big predictor of it. And calf tightness, specifically tightness in the medial gastroc. That if someone stands in front of you and they raise up on their heels, you have two big muscles in the back. There's like a ball on the inside. That's the medial gastroc. That's the balance muscle. Medial gastroc, when you're standing still, the inner calf muscle attached to the Achilles tendon stops you from falling forward. It brings you back and balances you. It's more active than the lateral gastrocnemius.
So is this common practice? If someone sees their podiatrist or if someone goes to the if someone and they have plantar, because I don't think physical therapists, I don't think this is, and maybe it is.
This is all new stuff. I mean, I've been writing about it for 5 years, and it's becoming a little more out there. A lot of people follow the protocols I've come up with, which is really nice. So if you go to someone who keeps up with the literature, they'll know it. But it's not, you wouldn't see it if you just went to a regular doc, unfortunately. They'll still do corticosteroid injections, which, it can weaken tissue. I just see such good outcomes with prolonged static stretching. And it has to be prolonged, because if you just do short duration stretches, they aren't effective. Someone recently published an interesting paper that they followed up when you did a series of 90-second stretches to stretch the back of your calf. So you were stretching the back of your calf 12 minutes a day. After 12 weeks, the muscle was larger without any strengthening. There was hypertrophy because of the stretching impaired circulation, which increased growth hormone and made the muscle physically stronger. And the tendon was more resilient, and they had huge increases in jump height. And they did this study on volleyball players. Panidi, I believe, was the author of that. And that was a great paper. They've repeated it and gotten the same outcome. So prolonged static stretching and aggressive strengthening, especially strengthening muscles in their lengthened positions. That's key. I mean, the outcomes go through the roof.
It's so exciting. And that's when I found, when Dr. Claudia Tomas turned me on to this, it opened up a whole new world to me. I was like, wow, that's so interesting.
Those are the kind of people who are picking this up. She's a high-end physical therapist. The PTs who work with professional athletes, the PTs who work with a lot of high-level people all know this stuff now. Like I said, the products that I've made are being used by tons of athletes, but I made them for people in their 50s, 60s, 70s, 80s, and 90s. So,
but that's how fantastic that we can, let's just even go a little more into that, because you talk about something called the anterior fall envelope. And the key thing is with osteoporosis is we want to prevent falls. We want to, and we do so much. We're working on Tai Chi and Qigong and balance and this and that. But this toe strength piece is missing, but yet it's huge. So to explain the anterior fall envelope, because I think that's a good concept.
Yeah, the anterior fall envelope is a common term that's used in research to study what are predictors of falls. And when you stand up with your arms at your side, the distance that you can lean forward is sometimes measured with a laser scanner in the back. You can measure yourself at home with a laser scanner. The distance someone leans forward like that, they should be able to go a minimum of 4.5 inches without losing balance. And the main thing that allows you to do that is as you lean forward, your toes are pushing down to control you. So it's just a measure of toe strength. So the anterior fall envelope was the first test in that fall prevention program. And that's where I stand behind someone and I have a laser scanner. And now I say, put your arms to your side and lean forward. And as they lean forward, I measure the distance in the mid-thoracic spine. And it should be a minimum of 4.5 inches. Super easy to do. But you don't even have to measure it, just do it. And you should be able to go stand up now and lean forward. You should be able to go pretty far. If you have to pull a leg forward and do it in a safe spot where you can grab a wall, if you lose balance before you're at a good angle forward, you're at a high risk for fall.
And then if that's the case, it's strengthening.
That's toe strengthening. And sometimes you have to do calf stretching with that, but that's pure toe strength. You control your toe strength. What predicts lateral falls is impaired sensation on the bottom of the foot. What predicts forward falls is toe weakness. And then you can have, vestibular problems that can cause falls with head movements. So, there's so many things, but most falls are related to specific things that you can do simple interventions for. And that's what that human locomotion fall prevention. Yeah, I love it. It's just
so exciting. Who would think that this toe strength was, and it's so prevalent. How prevalent is this weakness in the toes?
Oh, and people over the age of 70 is probably 60%. I mean, it's rare to get someone who's over 70 who can generate 10% unless they've been lifelong athletes. And even in young athletes, I treat a lot of professional marathon runners, and I've got guys who run 2:11 marathons who have toe weakness. Surfers have the strongest toes in the world, so do Irish dancers. So certain sports are famous for having great toe strength. But also this is important, and it's the reason it's catching on with athletes. They did 2 studies out of Japan showing that toe strength predicted high scores on agility drills. When you play soccer, when you have a soccer match, you change direction 700 times. And the last thing touching the ground when you're pushing off to the side is the tips of your toes. So if you don't have strong toes, you're not going to be agile. So it's a predictor of agility. In fact, I'm doing a program now for professional athletes it's more aggressive than the standard one that I do for fall prevention. And it involves weights and pushing forward into a wall and prolonged isometric contractions to improve tendon resiliency.
So how do you work with people now? Are you still working one-on-one?
No, I retired. I practiced for 43 years. So I retired about a little over a year ago. And when I retired, it gave me more time to read and write. So I'm doing more research now, and I want to start publishing more papers. I probably publish a paper every 2 months. We're just finishing up, one now on hip rotator strength and sciatica. But now I want to get research stuff done on fall prevention in different facilities. But it's tough getting research done now because no one has funding, and everything's takes too much time.
Hey, Margie here. High-quality supplements are a big part of a comprehensive osteoporosis program. To help you, I offer a significant discount every day in my supplement store through FullScript. FullScript has the most extensive catalog of professional-grade supplements and wellness products I've ever found. So all you need to do is go to tinyurl.com. That's tinyurl.com/supplements for less. And you'll get to my FullScript store, and in there, you'll see my favorite bone-building supplements. So make sure to check it out, and the link will also be in the show notes. So let's get back to the show. That toe putty, let's talk about that, because so many people start having deviations in bunions. So this community, bunions are a hot thing. So let's talk about about your bunion putty.
Well, I just published a paper on bunions. It was put in Dynamic Chiropractic, and it was the latest research on it. They could never figure out why some bunions are painful and other ones aren't, why some impair balance and other ones don't. Some people who wear high heel shoes don't get bunions and other people do. And some great researchers recently showed, I got a skeleton here. Then my wife was nice enough to go, she said, "Do you want a skeleton?" I was like, "No, I'm good." It turns out I could use it. So if you look at this joint right here, right? That's the first metatarsal. This is where a bunion forms. That's first metatarsal cuneiform. They showed that this joint right here is connected with anywhere from 1 to 3 separate articulations. So different curves that articulate and lock. If that joint is connected with just one connection, then this bone is mobile and you're going to get a bunion. It's predictive of a bunion. If it's connected with 3, then the joint is stable. Remember I said before people who are flat-footed, and that can happen in people with neutral arches. So it's not just people who are flat-footed that get bunions. Anybody can get them. But almost all of them have a single articulation to this joint, which is why if you get bunion surgery, they often fuse this joint. Surgeons are aware of the connection, so they'll fuse it to stabilize it, and it's got good outcomes. But I prefer strengthening a muscle called peroneus longus. Peroneus longus wraps around the outside of the leg and attaches to the base of that joint, and it has fibrous slips that traverse both sides. So when it fires, it locks that joint. And most people are weak in that muscle. So I came up with a way to measure strength by putting that card under it that you had your toe strength measured and pulling out at an angle like this. And it measures your ability to push down here. If you can't generate a certain force, then you do exercises where you push up at an angle, and you can do the ToePro for that. But research out of Thailand showed that if the bunion has progressed and it's a larger angle like this, they sell these self-made silicone bunion pads that you make custom make to fit into all the nooks and crannies, because you can't just use a regular toe separator because everybody's foot is shaped differently. So bunion putty contours all the different bony articulations in there, and it just makes it more comfortable. And I used to use one that was made by a German company, but they charge like $90 for a small little tub of it. So I found manufacturers overseas that would make it for a more reasonable price. And they showed that if you make a night splint for yourself and put it between the bunion and the second toe, it decreased that angle by about 4 degrees over time. And it just can prevent it from getting worse. So it's easy to do. And I sometimes have people wear that when they're doing their foot strengthening exercises. That was another one. They showed people with bunion have weakness of that abductor hallucis. Abductor hallucis is an important muscle that runs from the heel, hatches the base of the big toe. And if it's weak, you lose control of the big toe, and then it moves into a position of causing a larger bunion. So strengthening exercises to pull that back can lessen the degree. One researcher out of Iran showed he was able to appreciably change the angle of a bunion with foot strengthening exercises, night braces, and mobilization manipulation. And it didn't get enough press. But again, that article's on the site. I just came out with it in June. So if you just go to humanlocomotion.com, go to articles, and then look up a bunion article. I drew all these illustrations for it, and then I drew all the interventions for it.
Okay, so let's just review, because there's a lot of people listening who have bunions. So if you get the putty, and I'm going to get the putty, and if you get the putty, exactly how long should you wear the putty? What have you found?
Well, in that study from Thailand, they made a large one. They just wore it at night while they were sleeping. A lot of people who have bunions will make smaller ones and wear them during the day just for comfort. Because when you're too mobile in that first metatarsal, the inner forefoot moves up and down, and you generate a lot of shear between the bunion and the second toe. So it just separates the two to make it a little more comfortable.
So do you have a recommendation, or either one is fine as long as you wear it at night?
People with large bunions should make two. They should make one that they wear during the day that's smaller and one that's large at night. People with small bunions, if they're not in pain, they don't need to wear it during the day, just occasionally at night.
And then, so we do that, we strengthen with the ToePro, and we can improve our bunions. Do I have this right?
You have that right. And,
okay, well, I'm going to try this myself. My toes are so much stronger. This has been like unbelievable. That's why I wanted you on.
I usually tell people to do that 10-second balance test, which has been getting a lot of press lately. New York Times just read a little short summary of it. It was a test that I think there were 12,000 people in, and they followed them for 7 years. They just had them stand on one foot barefoot with their eyes open and asked them to see if they can balance for 10 seconds, arms at the side, looking forward in a stable area. And if they got 3 tries to do it, if they couldn't do it, it had a huge effect on their overall mortality over the next 7 years. They were significantly more likely to have cardiovascular disease and die from multiple factors, and especially fall. That test takes 10 seconds to do. And when you do foot strengthening, you usually improve with that really quickly. So I like to, whenever I recommend something, I always like to have an objective test so people can monitor progress. So you can see. So you just don't do it blindly. It also motivates you to keep doing it. And unfortunately,
we used a dynamometer, and yeah, it's really gotten stronger. Okay, so we have. I don't want to miss anything that you have on the site. So we talked about, you have a peripheral neuropathy kit for people with that. You have the ToePro for everything.
Yeah.
You have those. What is it called? The buddies, so that you can prevent this cutaneous.
Oh, the balance buttons. The balance buttons, again, are my favorite for fall prevention. But we also have a product called the Twist Disc, and it's 2 plates with a spring-loaded mechanism. Everybody strengthens their lower extremity. They do leg presses. They do seated leg extension. No one strengthens in the transverse plane, the twisting plane. And a study years ago came out where they measured the ability to generate force and rotation in the limb. And athletes who couldn't generate 20% of their body weight with a rotational test were 7 times more likely to tear their ACL. They were more likely to have foot ankle injuries. It was a big deal. And that was in one season. So I made it, but no one ever gives strengthening exercises in the transverse plane. So I made this, you'd have to see it on the site. It's hard to describe here. It's two discs with this spring in the middle. It's too hard for me to spin it like this, but you stand on it and you spin it back and forth like this. Again, it has up to 50 pounds of resistance. So when you're first doing it, you'll only turn a small range. So you just do a lunge on it with your foot twisted a little, and then you just make your foot go like this. And people, as they get older, they get meniscus injuries in their knees. And there's a muscle called popliteus in the back of the knee that controls rotation. So I made that to strengthen popliteus. Like most things, that one I made because I have horizontal tears in my menisci because I play tennis every day. And it was really hard to manage, and I would have to take time off if my knee started hurting. So I just had a series of TheraBands, and I'd move it like this, but it was awkward. So then I made a prototype out of this with wood and put a large series of spring inside, and it worked so well. I had a CAD/CAM person make up a polyurethane version of it, and then we locked the spring in there so that it can strengthen in the transverse plane. And in fact, the PT from Chicago just today told me he gave it to one of his NBA players who says it's really helping him a ton. It's great for tib posterior ankle injuries, but it's really good for people with knee arthritis. That's good like me. And I just love it. If I don't do it, my knee starts to bother me. Like all these things, unfortunately, strength gains, you got to stick to it. You can't do it on occasion. But that's why the article I'm writing soon is, what's the minimum dose of strengthening that you can do? One paper showed that 1 3-second maximum isometric contraction per day was enough to stop atrophy or stop strength loss. So, and then I found a bunch of papers showing that once a week works just as well as 2 or 3 times a week, especially in older people. And the rules that apply to young people who've had all the research done on them do not apply to people over their 60s. Because they have fewer satellite cells. It's harder to stimulate, just like with bone growth. You can't stimulate. You can get bone to grow in a teenager easily. Someone just published a paper showing that runners, as they're older, get tons of tibial stress fractures. It's a really common running injury. I've seen 1 million of them over the years. And someone found that if they play multi-directional sports from the age of like 12 to 16, they have different cortical geometry on their tibia, and they're way less likely to get tibial stress fracture. So the tibial stress fractures in kids who play soccer, they encourage people to start having their young kids not run, but play multi-directional sports like lacrosse and soccer, because the stresses on the bone are different, and bone remodels at that age at a fast rate, and it actually changes the shape of the cortex on the tibia, which I thought was fascinating.
Wow. So when we do this, we need to be in really good posture and not torque our bodies or anything when we're doing the rotation. Yeah.
Yeah. Yeah.
That's great. Any other, how do you think of that site? Is there anything else that you're recommending for people? Because these are great. Well,
Michelle, there was a Michaud protocol that I read years ago in American Journal of Sports Medicine. They took football players and they wanted to figure out ways to improve their proprioception after ankle sprains, their balance. And football players, I guess, are notorious for not doing rehab, which surprised me a little. Maybe they don't do balance rehab. So an orthopedic surgeon came up with a protocol with a couple of other authors, and he just had people stand on this balance pad for 5 minutes on each foot before they did their workout. So he put it in the front of the gym, said, you got to go do this before you can do your workouts. In fact, subsequent research has come out and said if you do it 5 minutes on one foot one day, then 5 minutes on one foot the next, you get the same outcomes. So they use the small little balance pad, which I have one, that I loved. It was like this thick, and it's just a foam pad, and you just stand on it, right? The one they used in that study, they stopped making. So the other ones are just too expensive. So I went to China, and I duplicated the size and durometer or firmness of the one in the original study, and then made it more affordable, because like the AirX balance pad is nice, but it's like $90. So that one, you just leave in your workout area and you just stand on it. You keep your eyes open. That was a great paper on balance. They said that you start to lose muscle mass at like 45 to 50, and it's 1% to 2% per year. They showed you lose balance at an accelerated rate. You lose balance faster than you lose sight, hearing, muscle strength, flexibility. Balance is difficult to maintain and needs to be worked. So I just have people stand on that a few minutes each day. So it's a short commitment, and it improves reaction time. It's good for your vestibular system. It's good for everything.
Yeah, because I mean, I'm big into standing desks, sit to stand desks. So that's perfect, right? While you're even working, you can just throw that balance pad. These are great. I'm so impressed, and you have to be commended for what you've done. This is,
Why, thank you.
I mean, we're trying to get the word out there because I can't. As I said, I was so excited because all the women, everybody in my program, we all bought it. We all bought this, and we've all now been doing it at home because it's so good. I mean, it's just really a wonderful little device that's easy to do, and it's not the typical, as you said. These are different exercises, and it's
I like it because it's quick and easy. It doesn't require any machinery. It doesn't require you going out to the gym. It doesn't require TheraBands that you got to hook around a wall or like a table and go back and forth. It's just quick and easy. And then you just push it out of the way.
right. But who would think it's so amazing, the results and how that, we want to.
Yeah, I was surprised by the results that it got. Like I made a lot of things from in the 40 plus years that I practiced. Whenever I had a patient who needed something, like there was a person who had an equinus where their heel was leaving the ground prematurely, so I made a hinged ankle drop device, and then I hooked up different ways to put constant stress on it. I made bound rock boards. I've made stuff for the last 40 years just for people who needed them. And I had a patient years ago who would not do his foot strengthening. So I made this little wood platform with springs where you went back and forth like this, but it was such a pain in the neck to make. I said, and it worked well. The guy loved it. I said, oh, I'll see if I can make one that is foam. It's easier so I won't have to spend so much time in the tool shed putting things together. And then this worked out well. And I've been really surprised at how quickly it caught on. I mean, it's everywhere now. I mean, I'm surprised. The company increases like 40% annually, and we don't do. I mean, I don't do anything to promote it. I mean, I wasn't even going to come on this show because I hate to.
Yeah, I had to really I had to twist your arm. I wrote the minute I asked, who is the person who created this? I asked Claudia, and I wanted to buy it myself. Initially, I'm using it there, and I'm thinking, I just want to buy this. I want to do it at home more. And so that's when I asked her. And then she gave me your website, and she said that, she teaches all your stuff. So she's been doing this for quite a while, and all the videos, and then you sent me all the papers. But it took a really long time. So I'm so grateful because this can change someone's life. It's just, if to prevent a fall is huge. To prevent bunion pain. I mean, so many things you have done are just amazing. So
Well, my mom had a lateral fall and she broke her femoral neck, and she was Parkinsonian, so they didn't even replace it so I saw the devastating effect of that, and that was years ago. So I never forgot it. And then I started doing research a few years ago. She passed a while ago, trying to understand why lateral falls are so bad. And I wrote a paper on that, and it's a complicated thing to explain, but it's papers on the site, and it's really interesting information. That's where the balance buttons come in handy to prevent lateral falls. But yeah.
No, this is just so great, and it's I'm just so impressed with what you've done, and I love these. And I always love learning new things and sharing new things. That's my favorite part of having a podcast, because someone's going to say, oh my gosh, my balance is so much better. And as you said, people want to do as much as they can for their bones. But yet this balance piece, every single person has to work on balance. I mean, it's essential. And the good news is there's so much that can be done. That's at every age. So to me, it's such a win-win. It's something you can focus on that's going to completely change your life. And it's just so good. But I have to tell everybody, so you're giving the community a discount with Happy Bones, and I'll put the link. I'll put the link in the show notes so that everybody's going to get a 10% discount if they use Happy Bones, which is exciting. And if anybody wants any of the articles that I talked about, all the articles that I've written, and I put all the references in there, they're on the site. But I have access to all the original articles too. So if there's any like PTs or chiros out there or doctors who want more data, feel free to reach out to me, because I love sharing this stuff. I mean, I just find it fascinating. And now that I'm not working full time, I just love learning about this stuff. I just don't like going out and lecturing about it. So I just would rather sit home and write stuff. Well, how fun is that, right?
It's the
It's
best.
I love that too, because I used to be a physical, work one-on-one with people, and now I do talks and summits and different things. But to hear how someone got the information and it's changed their life, there's just nothing better. I mean, you can really affect way more people. So I'm just so excited that you're here and we're going to share this. And you have to let me know, everybody, whether your bunions get better, what happens with your toes. And yeah, so for anyone that ends up doing any of these things, I want to hear. You'll have to share. Anyway, any
Yeah.
last minute things you wanna
No,
say?
thanks for having me. It's really great. I mean, you're doing a really nice service for people. So keep up the good work.
Oh, well, thank you again for everything you did. I'm going to just keep following you and learning as much as I can. So next time I'll probably have every every gadget on that website. Next one is the bunions. I'm getting that,
Well, I'm finishing up an article today on a muscle called obturator internus in the hip and how it causes sciatica. And my wife did a lot of the illustrations. I do the technical illustrations, but that's an interesting one that anybody who has sciatica, that should be out. And it's not a product, it's just like new information on rehab exercises and stretches you could do. So that should be out in about a week or so.
Wow. Well, thank you so much for everything you do, all the free information, all the things you've created. Because yeah, even besides that, there's so much free things that you can do that will make a difference. So
Yeah,
it's such a pleasure. I'm glad we were able to do this. Thank you so much.
absolutely. Thanks for having me. Really good talking with you.
Wow, Tom is just a wealth of information. I hope you enjoyed the interview as much as I did. And the key points, I think, because there was a lot of things we talked about, is that our toe strength is essential when it comes to balance. And it's something that most of us are not doing specific exercises. And when we do them, we're going to improve all sorts of things with our feet, but we also will reduce our risk of falls. And at the end of the day, that's so important. I'm such a big fan of this ToePro, as I mentioned, and Tom's giving our community a 10% discount if you use Happy Bones. We'll have all those links in the show notes. I'm personally going to try that putty. I haven't tried that yet. And, I just hope you can take whatever works for you and just even look at his site, because a lot of these things, no one has to live with pain, has to live with weakness. And if we can prevent falls, by all means, we want to do that. So thank you so much for tuning in. And I look forward to seeing you on the next episode.